Okay, start.
Yes.
Hello, I am Dr. Bishas. I am a doctor of this clinic. I
Yes.
confirm that you are daughter of our patient, Mr. Says Crawford, 90 years old.
Yes, doctor.
And I came to know that you want to talk to me about your father's condition. Is it right?
Yes, doctor.
So I am here to discuss about your father's condition.
Okay, doctor. I also want to know more.
So can you please tell me that actually what is your concern and what do you want to know from me?
Doctor, how is my father doing now? Okay, he was very much breathlessness. I am the only take carer of my father. I've been taking care of him for the last 7 or 8 years, and he already had some previous health issues. Okay, he had some one stroke, and also he has diabetes. So you know that he got admitted with severe breathlessness. So I just want to know, doctor, how is he doing now?
Yeah, I'm extremely sorry for your father's condition. And before I give you the answer, can you please tell me that how far do you know about your father's current condition?
Doctor, I just know that he was severely breathless, and he was then he was. I took him to get admitted here, and afterwards I saw him twice after being admitted, and I think that he's not getting well. Okay, so I didn't feel that he was easing up, and I'm very worried, doctor.
Okay, I'm again sorry for your father's condition. And do you have any idea what is his diagnosis or why he has developed why he has deteriorated so much this time?
Doctor, I don't have any detailed idea, doctor.
And I am sharing with you that we have discussed your father's condition with your brother. And if you don't mind, may I know that have you talked with your brother about what was our decision and what would our management plan?
Uh, Doctor, he didn't tell me very much, but he told that it was not good what he told. So actually, he didn't open up very much to me. Actually, my brother knows that I am the carer, so he uh, gave opinion that I should talk myself with you. So I'm very worried too.
Yeah. I really appreciate and I praise you that you took good care of him. And actually, this time he has developed a condition we call it congestive heart failure. Do you have any idea for that?
No, doctor.
Actually, in this condition, the heart cannot work properly. So he's not getting enough blood supply. He's not getting enough good air supply. For this his condition is deteriorating so much. I'm sorry, actually sorry for him.
Okay, doctor.
Uh, do you have any idea that what would our further management plan would uh, include?
No, doctor. I just know that he's actually an aged person now. He has some previous stroke and some issues with his blood glucose level, blood sugar. So, how is he going to show up now? How bad is it, doctor?
I can understand that you love your father very much, but I am sorry to say that his condition is deteriorating, and it is likely that his condition won't improve with any intervention. I am extremely sorry to say that.
What are you telling, doctor? Is he going to die, doctor?
I'm actually sorry to say, but his condition isn't improving, and it is likely that his condition is going to be very worse, and he may die. I'm sorry to say that.
Well, doctor, he's still on the ward, doctor. So why don't you shift him to ICU, doctor? I have heard that ICU is very good for this type of patients.
Actually, you heard that is partially true. And before I give your answer, is it okay if you tell me that how far do you know about the intensive care unit or ICU support?
Well, doctor, I know that in the ICU them they gave the patient some machine supports, and this can be life saving. And also they give some medications through blood channel. I think this can be life saving as far as I know, doctor. What do you think?
Actually, you know that is true, but as I told you that your father's condition is getting worse. His heart isn't working, and also he has some other previous condition. And at this stage, he has been reviewed by the senior doctor or consultant, and all his signs of this deterioration giving a sign that he's going to he's at his last stage of his life, and his condition will deteriorate even if we do anything. I'm extremely sorry to say that.
Is there nothing more you can do, doctor, now for him? What you're telling is very so much disappointing, doctor.
Yeah, and I can understand what is happening through your mind this time. But as I have told you that this condition, this is the deteriorating condition. It cannot be reversed. So giving him any machine ventilation or any extra device to support his condition this time will just increase his pain and sufferings. That will not make any benefit for him. But that doesn't mean that we are not going to give him any treatment, uh, any medication or any uh, other facilities that we can do for him. Do you get me?
Doctor, what facilities, doctor?
Yeah. And I am again sorry for your father's condition. And as I have told you that his condition is deteriorating worse, and he is at his end stage of life. At this stage, we try to give them treatment that aids their symptoms, that doesn't distress themselves, and that can help them to uh, get them pain free. And we are we are giving that, and we are going for that.
Well, doctor, may I know that I heard about a medication named morphine. Are you going to give him that for pain medication?
Actually, you heard about that, and that is true. And if he needs that, we will go for that.
Well, doctor, I have another question. That I heard that this morphine can actually cause death. It can slow down the breathing. One of my relatives was once in a situation like this, and he told me about it. Is this true, doctor? Then are you killing him? Are you going to kill him, doctor?
I can understand that you are really worried about your father's condition, and I can also respect your concern. And as you have heard, that is partially true, because if it is given at a high dose, that can cause this condition. And if he needs this, we will give him this dose at a very moderate level that will not make any distress for him. Rather, it will remove his distress, remove his pain, and also if it is given at a good dose, then it can also remove the distress of the shortness of breath.
Okay, doctor. Okay, and well, may I ask you one thing? That you told that uh, you talked about it with my brother. Well, are you somehow influenced by my brother actually? Because I'm the caregiver, doctor. He is not the caregiver, so he might comply with your talkings. But I would like you to try more to save my father.
And actually, we took this decision independently. Our senior consultant, who is specialized, who is very expert in this situation, they have reviewed him and they take their decision independently. We do not take any decision by any other person influence, and we always do what is the best treatment for the person. And
Okay,
I am
doctor.
yes, I can understand that you are very distressed at this moment, but I can assure you that we didn't take any influence, any concern or anything, any pressure from your brother. I'm extremely sorry for your father's condition.
Okay, doctor. Okay, but actually, it's a life and death question for my father. Actually, you can understand, I think. So, please, can you tell me a second? Can you take a second opinion, or can you speak to someone more senior
Okay,
about it?
okay, it's always your right to seek opinion, but what I have told you, that was their decision, and I am just delivering that. And if you need to talk with anyone, then I will certainly arrange this as soon as possible.
Okay, doctor. Okay, doctor. That's all right. Then there is nothing more to do. Actually, I will just have to wait him for getting worse and worse, and just let him die.
Yeah, I can understand that you are really worried for this. Actually, we are doing what is the best option at this point with her, and we are continuously reviewing him. Even if his condition get better, and if there is any other alternative arises at any time, then we will certainly go for that. We will do all the best, all the good for him. We will always try for that.
Okay, doctors, do whatever you like.
I'm extremely sorry for your father's condition. Actually,
Okay, doctor.
is there anything that I can do for you now?
Doctor, what can I say? Actually, I can't say anything now. You can shift into ICU, and I have nothing to say, doctor. Actually.
Yeah. And, as I have told you, I can understand your concern. As I have told you that this ICU machine, this medication won't bring anything good for him. Rather, it will make distress. This tube through the mouth, this channel, blood channel medication, that will just make him distress. Because yes, this is very last stage of life. At this time, I think that no one and no one will allow them to go through the distress, and we are doing that is good for him, that is best for him at this stage.
Okay, doctor. Okay. Uh, okay, doctor.
And may I know that have your father ever expressed anything that can be done at this stage, or make any person of his lasting power of attorney, or make any advance directive?
No, doctor. I haven't noticed of any.
And may I know that do you have any other question for me?
Mm, no, doctor. Actually, I don't have any question now. But okay, doctor. Please do whatever you think is the best. But please keep in mind about my father. To
I am extremely
keep in,
sorry for your condition, and because we are doing what is best for him at this stage, and also we will give you the up to date results all the up to date information all the time. And if you have any question for me, or if you have anything to discuss, then you can always contact us. And also, I am making an arrangement with my senior that you want to talk about your father's condition.
okay, doctor. All right.
Okay, thank you.
So how much time is left now?
Time off.
Okay.
Okay, you can start questioning.
Yeah. So what was the task here?
My task was to inform the patient's daughter about the inappropriateness of ICU at this stage, because she was asking for the ICU support at this stage.
Yes. Okay. And how did you think the conversation go?
Yeah, I think I have been able to convince her, though she wanted a second opinion, and this is her right. This is her right to seek for second opinion. But whatever I knew, and what But the question was, I have tried to answer them honestly and without hiding anything from her, including that his father is going to die soon.
Okay, and actually, okay, that's all right. I think you have done very, very well in this case, because the patient actually, the surrogate actually asked a lots of questions. Okay, and I think you did really well. And you also covered about the morphine issue, uh, because many surrogates actually are get a bit worried about the morphine issue, I think. So you answered that well. And may I ask you that you told about that the patient is going to die. So is it appropriate to tell that even if he shows any signs of improvement, we will again review him? So I think, is it correct to say?
Actually, I have, as I have informed her, and I was just trying to convince her that this condition all are signs of uh, end stage of life, and he's going to die. But I, at the same time, I reassured her that even if I am always following her up, we are always getting her up, even if is there any alternative arises at any time or his condition get improved, we will always certainly take decision on that basis. That is, we are not made final decision that he is going to die.
Mm-hmm. Okay, okay, that's very good.
Do you have any other question?
I don't have any other question. Actually, you have done excellent in this case, I think. Do
Okay.
you yourself want